welcome. You're watching Health and Wellness Myths and Facts. The topic of men's health, both physical and mental, is often swept under the rug. It's important to remember that men's health is not just a man's issue, it's a family issue and can impact everyone around them. Hormones play a powerful role in the body's regulatory system, and proper hormonal balance is essential to maintaining optimal health and plays a crucial role in how one feels. While it is common to associate hormonal disorders and imbalances with women, many hormonal imbalances are seen as a sign of aging or even inadequacies in men as well. Just like women, men also undergo changes from childhood. These include physical hormonal changes. Men tend to accept changes in their body just as a part of the aging process. However, most symptoms of aging are actually caused by hormonal imbalances. It is true that as men age, they are more likely to experience male hormonal imbalance, but there are other contributing factors to this as well. Fortunately, male hormone imbalance can be successfully treated. Living a long, healthy life is easy if you know the symptoms and the prevention strategies. Today, we have with us eminent endocrinologists who will help you understand how to manage a man's hormonal health. Professor Dr. Sameer Aggarwal, diabetes and thyroid specialist, Apex Super Speciality Hospitals, joins us from Rohtak. Dr. Siddarth Rakhe, consultant endocrinologist, Convenient Hospitals Limited, joins us from Indore. And Dr. Akhil, Krishna, endocrinologist, Kim's Hospital, Trivandrum, is also with us. Thank you all very much for being with us, Dr. Aggarwal. What is the role of hormones in our body, and why is your endocrine health so important, especially in men?
Good afternoon all. I think yes, hormones are definitely very important. Endocrinology means dealing with hormones, and hormones are required for controlling and coordinating internal metabolism of the body, whether it is talking about reproduction, lactation in females, growth in boys and girls, onset of puberty, maintenance of blood pressure, maintenance of bone health, development of secondary sexual characters. I think hormones, they have a role with regards to almost each and every system of your body.
Right. Dr. Rakhe, what are the most common hormonal disorders in men?
All right. So as far as hormonal disorder in men are concerned, certain form of Cushing disorder, hypogonadism, androgen abuse remains the common hormonal disorder in men, but none of them comes even close as far as obesity and the malarkey of complication which obesity brings. Just an exercise, look around you, and it might be rude, but look around the abdomen part of the men around you. You will notice that more than 95% of the men have some form of abdominal obesity, and we were not always like this. I mean, just try to imagine a photograph of your grandparents or parents' wedding, and there must be a black and white photograph with 10 to 15 people standing, and then try to compare that photograph with the photograph of most recent wedding you attended. How can you spot the difference? How much the morphology has changed? And when you couple it with the fact that this obesity, this adipose tissue, is a source of multiple hormones, including estrogen, multiple inflammatory cytokinins in male body, then you can truly understand the extent of the problem. So if I were to pick one disease which is most common in men, I would say hormonal disease which is most common in men, I would say it is obesity.
Right. Very interesting, the way you point out that analogy. Dr. Krishna, many issues affect young boys, such as their inability to develop enough hair, or display masculine characteristics for that matter. What could be the reasons?
Yeah, thanks for that question. It's a very important, relevant question. So regarding the facial hair growth in men, it is considered to be a sign of masculinity by the society. So regarding the facial hair growth, two factors mainly influence the facial hair growth. One is genetic, second one is hormones. Genetic factors are something which we cannot alter. So coming to the hormones, which we can do something about it. So when a man or a boy comes to us for decreased facial hair growth, my main concern is whether there is any hormonal disturbance in our body. The main sex hormone, testosterone, it is named as testosterone, that is what controls the facial hair growth in men. So when a man approaches us for low facial hair growth, we will see if the person is having low testosterone in the body. We all know that testosterone is produced from testicles or the balls, but it is controlled by a small region in the brain known as the pituitary. So when we are approaching a patient, we will be seeing if there is low testosterone in the body. We will clinically as well as by blood test, we will analyze that. And if there is low, whether the problem is at the level of pituitary or whether it's a problem at the level of the testicles, and that we treat accordingly. Thank you.
Right. Dr. Aggarwal, what changes happen during puberty in boys and what can go wrong with puberty?
So, in fact, that's an interesting thing. Development of puberty, transition from childhood to adulthood. That's what happens with puberty, both in boys as well as in females. So there are some common things which can happen with both males as well as females, but particularly talking about transition from childhood to adulthood, that usually suggests the onset of puberty. In boys, they have muscular development, their voice changes, they have height spurt, that we call it as they gain in the height, or the growth spurt which happens, and there is an increase in the lean body mass, and usually the body fat mass decreases, but there is an increase in the lean mass that happens in the boys. So there is increase in the testicular development, penile development. In fact, that's the basic teaching. The earliest sign of puberty in boys is increase in the testicular development. So if there is some problem which can occur either in the brain or it can occur in the testes, then there can be problems in this puberty onset. So boys, they can have problems with regards to their testicular development, with regards to decrease in their secondary sexual characters, decrease in the facial hair, and that can cause problems later on in the fertility also in boys when they get married. So usually they do not have that height spurt, their bones do not increase in their mass, so they can have decrease in the bone mass. But usually that what happens with delayed puberty, whenever the puberty is not occurring according to the set staging, that usually happens with the absence of facial hair, and they have smaller testes and penis size.
Right. What changes, Dr. Aggarwal, happen, during puberty? I think this is something that you've explained very well. But Dr. Rakhe, if we could just take that a step forward, how does puberty affect emotions, moods, thoughts? How does it affect your emotional well-being?
Right. So puberty is associated with many changes, both in physical and mental dimensions. There is a height spurt, there is increase in height, there is increase in the physical strength, there is attraction towards the opposite gender, there is increased cognitive abilities. At least some part of the cognition is improved. And at times these changes can be associated with some difficulty in behavior, difficulty to cope up with the changes and aggression. But you see, the one good thing about change is something new awaits you on the other side of the change. You see, something old was there, change happened, and then something new is here. It depends upon you whether that new thing is good for you, neutral for you, or bad for you. And see, one of the main problem nowadays, it's very difficult to concentrate. There is social media, there is internet. I always teach my patients who are facing difficulty in coping with the change, because change is always associated with some form of friction. So I always teach my patients to learn the art of concentration, learn how to put your 80 plus billion neurons into one goal which you have decided for yourself. I want to achieve this, or after puberty, I want to be this person. And I think all these problems of moods and behavior which comes through puberty, if one can master the art of directing that energy of puberty towards one goal, all these problems can be sorted out. So,
right. Taking off from there, Dr. Krishna, if you could just explain to viewers how important is good and healthy nutrition, therefore, during puberty.
Yeah, healthy nutrition, as we all know, is important throughout the lifespan of a person, starting when you're born in the womb of a mother. This is important starts. So coming to puberty, it's a critical phase during the life of any person. So during puberty, many physical as well as mental changes happen to the boy. So during that period, as sir previously pointed out, many physical changes happen, including increase in the height of the boy. There's a pubertal growth spurt which happens during the puberty. So for these changes, optimum nutrition, good and adequate nutrition in the form of adequate carbohydrates, fats, proteins, and micronutrients, very important, like calcium, iron, and other vitamins and minerals are very important. So when the boy is undernourished or undernutrition is there, means there will be decrease in the height spurt, as well as the onset of puberty will be a bit delayed. They will not develop puberty at the usual age group at which they should have. On the other end of the spectrum, there is overweight or overnutrition. So the boys may be overweight and obese. Those boys also will face some pubertal issues. When it comes to girls, there is overweight and obesity is usually associated with early onset of puberty. But when it comes to boys, overweight or obesity is not consistently associated with early puberty. Some boys may develop puberty earlier, and some boys may develop puberty even later. So the key is that they should have the healthy, adequate nutrition during the phase of puberty to have the normal pubertal development and the pubertal growth spurt. Yeah, that's it.
Right. Well, on that note, we're going to slip into a very short break, but our panel of expert doctors will be live with us on the other side. Stay tuned. Dr. Rakhe, beginning with puberty, males experience a variety of changes just like women do. What's the kind of advice that you'd like to give to viewers, suggesting that their life would be healthy, and, what's the kind of advice that you'd like to give to young men and boys?
So there is only just one advice which I would like to give, and that's learn how to stay fit. All right. You see, puberty is one of the main time when people start to put on weight and gain weight, and that obesity is the mother of all the illnesses in future to come. Our school principal, she used to tell us that whatever you will do in the years from 10 to 20, that will form the basis of whatever you will do in your future life. And if you learn how to stay fit, you are not only welcoming a healthy body, but you are also welcoming a healthy brain. And that part from 10 to 20 years of age is important, because you are preparing for the future. You are preparing for multiple entrance examination. And if you have a healthy body and a healthy brain, then it creates a huge difference so as to when it comes to your entrance examination, your studies, or your career, you see. And when I say stay healthy, it's not a vague thing. I'm being specific. Just two things. One, learn not to let the weight increase above a certain limit, and two, regular exercise. And in regular exercise, I don't want you to spend $1,000 or thousands of bucks on gym membership, or to spend big money on gym equipments. Just learn to run 20 minutes. Come hell or heaven, मैं 20 minutes दौड़ूंगा बस. If you can just learn these two things, not to put on weight and regular exercise, and that's just running, your life would be much different 10, 20 years from now, and your body will thank you later.
Right. Dr. Aggarwal, I think we've managed to establish that line with you. Students are busier with their studies. They spend more time on the screen. How much physical activity, therefore, is needed or recommended after puberty?
So not only after puberty, I think before puberty, during puberty, right from a child starts walking, I think it's very important that both boys and girls, they start being engaged in physical activities. We know that there is a great increase in pediatric obesity these days. So I think physical activity has its definitely a much role. And children who are engaged in physical activity, they will tend to be having a good height. They will tend to develop good bone mass. They will not develop osteoporosis later on. They will not develop obesity and other lifestyle diseases like diabetes and polycystic ovarian disease and other disorders which can be there because of weight gain. Each child should be active for around 30 minutes. I think they should be doing simple walking, running, and they should be engaged in some sort of sports activities. So not only after puberty, but before puberty, during puberty, a child should be physically active to attain normal bone health and to attain a good height. So that's very important.
Right. And Dr. Krishna, what could be the reasons for infertility in younger men, and how common is it really?
Yeah, thanks for that question. It's a very relevant question. So infertility is a problem which every doctors find it difficult to crack, because there are so many causes for infertility. When we broadly divide the causes, it could be because of the problem at the level of the female partner, we call this female factor infertility, or it could be the level of male partner or male factor infertility, or both of them may have some issues. And in fourth category, we may not be able to find out any problem even after extensive blood tests and investigations. So when it specifically comes to male factor infertility or a male partner infertility, so as an endocrinologist, I would divide the causes into three broad headings. The first cause is related to hormones, and second one is non-hormonal causes, and third one is where we are not able to find out any causes, unknown causes. So when it comes to hormones, we need to understand that male sex hormone, that is testosterone, is essential for the normal sexual function, as well as to have normal and healthy sperms in the men's ejaculate. So when the man is having low testosterone in the body, there can be issues with their sexual life, as well as there can be issues with the sperm count as well as sperm quality. With quality, I mean the sperm should be able to travel properly. That mobility is important to reach the female uterus and to have fertilized the ovum. And when it comes to the non-hormonal causes, mainly it is related to some obstruction at the level of the tubes which is transporting the sperm to the female uterus. So that those problems are usually dealt with by the urologist. And we are mainly dealing with the hormonal disturbance. So if the male is having some hormonal disturbance, we will try to find out where the cause is, as I discussed in the previous question, whether it is at the level of testicles or whether it is at the level of the pituitary, and we treat accordingly so that we will be able to further a boy.
Right. Dr. Rakhe, an allied issue, there are certain studies that show that men are actually more prone to sleep apnea as compared to females. Is this also because of a hormone imbalance?
So I wouldn't call exactly this an imbalance. You see, it is one of the characteristic of male hormone, which is testosterone, to retain salt and water. So when you give exogenous testosterone to a person who is already predisposed to obstructive sleep apnea, or the sleep apnea as you said, this sleep apnea may exacerbate. But whether testosterone alone can cause sleep apnea, the jury is still out. You see, at one hand, obstructive sleep apnea may be associated with reduced testosterone level in men. On the other hand, if you try and treat that low testosterone, particularly in a person who is already predisposed to obstructive sleep apnea, it may exacerbate obstructive sleep apnea. So the concrete answer, science doesn't have the concrete answer whether this testosterone level is responsible for obstructive sleep apnea. But yes, if a person is predisposed because of obesity, short night and whatnot, then exogenous testosterone may increase the severity of obstructive sleep apnea.
Right. Dr. Aggarwal, what are the treatment approaches for infertility in men?
So good question. I think here we have role for endocrinologists coming into play. So treatment for male infertility will depend upon what is the cause of the male infertility. If it's the cause in the brain or hypothalamus or the pituitary gland, which leads to low production of FLH and FSH, we usually give these injections to the males to improve their infertility. And in most of the males, we achieve success. So endocrinological consultation is of paramount importance if a male infertility is being worked up. Second cause can be the problem in the testes, which can be because of decreased sperm production. Third can be the problem where the sperms have the problem getting into the seminal fluid and exiting through ejaculation. So each cause has to be dealt with the etiology. Lifestyle changes, they are very important. Avoid using recreational drugs, which have become, of course, very common. We have seen patients going into gyms and consuming a lot of androgens, which can cause infertility. And so these nutritional supplements can be adulterated with androgens. So we have to be very cautious and vigilant. Maintain a normal weight, height, eat a lot of healthy food. If there is a surgical problem like varicocele, which is common sometimes, you can do a surgical correction. And if there is a blockage, you can, of course, go for surgery. As we were suggesting, that urologic consultation will come into play if there is some surgical cause like varicocele. So there are some assisted reproductive techniques like IVF, intracytoplasmic sperm injections, testicular extraction of sperms. So we will require the help of a urologist in those cases. But pituitary causes, brain causes of infertility like hypogonadotropic hypogonadism, we will need an endocrine workup and an endocrinology consultation.
Right, very interesting to understand how that works. Dr. Krishna, just like menopause in females, there's also estrogen levels that drop and does male hormone like testosterone also go down with aging? And can it cause stress or depression? How does it manifest?
Yeah, thanks for that question. Very important question. But still, we don't have a definite answer to that. But from the available data, I can answer that. So if you ask a female when did they have their first menses and when did the menses stop, we'll be able to get a definite answer, because they will have a day when this menses started and when they have the menses is over. But unlike in females, males do not have such a phenomenon. Even though they have the onset of puberty, after that, the male sex hormone level, that is testosterone levels, from the studies, we can say that it drops by around 1% from year, starting from 30 to 40 years of age. So there is a gradual fall in the testosterone levels in the body in a male person. But does it actually produce any problems in a normal man? Answer is no. It usually does not produce a significant issue. But in some men who have some associated issues, like they have some long-standing liver disease, kidney disease, heart disease, some other issues, this kind of fall can be accelerated and they can have issues with low testosterone levels. And some men with prostate cancer, they may undergo bilateral removal of the testicles as a part of their treatment. They can also have issues with low testosterone levels. So in some men, after particular age, they can have low testosterone level, which can manifest both physically as well as mentally. Physically, they can have alterations in their body composition. They can gain more weight, as well as mentally, they can have some issues like mental issues. They can have low mood, depression, anxiety, and so on. So mainly, our aim as an endocrinologist, what we usually do is we assess for other features of testosterone deficiency, and if needed, we will do a blood test to see if the testosterone is really low and treat only if it's absolutely needed. Yeah, thank you.
All right, I'm afraid that's all the time we have. Thank you very much, doctors, for joining us.